Has someone you love started showing subtle but worrying changes in the past year? Many people assume that death and old age happen suddenly, but the truth is that the body usually sends out silent warnings months, sometimes up to a year before life kicks in. The problem is that most people miss these signs because they seem small at first. It's only later, looking back, that families realize the signs were there all along, but by then it's too late to prepare, too late to make those last memories count. In this video, we'll talk about 5 key signs that usually appear a year before an old person passes away. Some of them may be things you've noticed but brushed off as just acting up. Others may be changes that seem tiny but actually signal the body's gradual slowing down. Recognizing these signs early gives you the opportunity to provide better care, cherish meaningful moments, and most importantly, ensure that your loved one's end of life is filled with comfort, dignity, and peace. Stay with us until the end, because these 5 signs can help you prepare emotionally and practically for what lies ahead. When you understand what's happening, you won't be held back. You'll be able to make the most of the time you have with those you love. Now, let's get started. Number 1. Significant weight loss. One of the earliest and most telling signs that a person may be approaching the final year of their life is unintelligible weight loss. At first, it may seem subtle. A waistline that suddenly needs to be tightened, clothes that seem dirtier, or a pre-dead appetite that starts to wane. Many families dismiss this as just part of getting older, but the truth is that losing weight without trying is rarely a good sign. It usually indicates that the body is no longer absorbing nutrients effectively. Muscle mass is decreasing and essential systems are speeding up. Going naturally leads to some muscle loss, but when it happens too quickly, it's a sign that something deeper is going on. The body may be struggling to digest food properly, or the person may no longer be able to process protein effectively, leading to muscle loss. This loss of strength not only makes movement more difficult, it increases the risk of falling, embarrasses the immune system, and leaves the person vulnerable to infections. Another reason for weight loss in the final year of life? Appetite changes. Many adults simply don't feel hungry the way they used to. Their sense of taste diminishes. Food no longer seems appealing. And they may start skipping meals or eating very small portions. This isn't just a matter of preference, it's a physiological shift. The body, sensing that it's starting to shut down, no longer signals the brain to seek out food as often. The result? Less energy, less strength, and a gradual decline in overall health. And then there's the role of subjective medical conditions. Weight loss is a common symptom of chronic diseases like cancer, heart failure, or heart disease. All of these can start to progress long before more obvious symptoms appear. Even conditions like depression or cognitive decline can lead to food shortages, causing a subjective spiral where the body doesn't get enough fuel to sustain itself. Some families try to solve the problem by encouraging their loved ones to eat more, offering favorite foods, or supplementing their diet with protein drinks. But if the weight continues to drop despite these efforts, it's important to recognize that the problem isn't just the diet, it's the body preparing for a deeper transition. At this point, forcing large meals into your body can't help. Instead, focus on comforting, easy-to-eat foods and hydration can make a bigger difference in maintaining quality of life. If you notice significant weight loss in an older loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This isn't just about physical appearance, it's about the body sending you a message. And understanding that message now can help you prepare for the path ahead with clarity, compassion, and the ability to make every remaining moment meaningful. Number 2. Extreme fatigue and weakness. One of the most noticeable changes in the year leading up to the end of life is a deep, persistent fatigue that doesn't go away with rest. It's not just feeling a little tired after a long day, it's a deep-seated fatigue that makes even simple tasks feel uncomfortable. Getting out of bed becomes a challenge. Walking across the room takes effort, and activities that once felt routine, like cooking, getting dressed, or even holding a conversation, start to feel time-consuming. This isn't just a result of aging, it's a sign that the body is conserving its remaining energy. As organ function starts to speed up, the body starts to prioritize what's most essential. The heart doesn't pump as efficiently, circulation slows down, and muscles don't get the same level of oxygen they used to. This is why many adults and individuals in their final months feel weak, shaky, and unable to sustain the same level of activity they once enjoyed. Another important factor is the metabolic slowdown. The body is designed to produce and use energy, but as it prepares for its final phase, that energy is redirected. Instead of fueling the body, it switches to preservation. This is why someone in a slowdown may start sleeping more, needing longer nights during the day, and finding it harder to stay awake for long periods. Some may even experience energy slowdowns, where they seem fine one moment but completely slow down the next. But perhaps the most emotional part of this process is the emotional impact of fatigue. Many seniors who once took pride in their independence begin to feel frustrated or even embarrassed that they can't do what they used to. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies. Not because they don't care, but because they simply don't have the energy. This can lead to a cycle of isolation, where they've stopped trying everything together, which only accelerates the slowdown. For families, watching a loved one go from active and engaged to tired and withdrawn can be heartbreaking. It's easy to assume they're just going crazy or that they need to push through it. But the reality is that forcing activity doesn't help. What matters most is understanding their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. If you notice a loved one feeling deep, ongoing fatigue that isn't relieved by rest, take it as a sign that their body is going through a major transition. This is the time to enjoy the conversations. Create moments of peace and support them without expectations. Because in the end, what matters most is not how much they can do, it's that they feel loved, understood, and comfortable. If you're still watching this video and are finding this information valuable, please comment number 2 below to let me know you're here. And if you haven't already, I encourage you to do so and ring the bell so you don't miss any videos. Your support helps us continue to create great content to inform and inspire you. Now, let's move on. Number 3. Increasing cognitive confusion or withdrawal. As a person approaches the final stage of life, one of the most striking changes can be seen in how they think, communicate, and interact with others. You may notice that someone who was once bright and engaged begins to forget things more often, struggles to follow conversations, or seems disoriented in familiar places. They may repeat themselves, forget names, or lose track of time, even when they never had memory problems before. These subtle cognitive changes can happen for months or even a full year before death. This isn't just everyday forgetfulness. The brain, like any other organ, requires a flow of oxygen and nutrients to function properly. But as circulation fades and oxygen to the brain diminishes, cognitive function begins to decline. The person may become easily confused, have difficulty making decisions, or struggle to recognize people in places they've known for years. In some cases, they may even have moments of lucidity followed by episodes of confusion, almost as if their mind is drifting in and out. Another common sign is emotional slippage. Someone nearing the end of their life often loses interest in social interactions. You may notice them talking less, engaging less, or spending long periods simply sitting in silence. It's not that they don't care about their loved ones, it's that their brain no longer processes emotions and engagement in the same way. Conversations become tiresome, random environments feel awkward, and eventually, many people retreat into their own world. You may also notice changes in mood and behavior. Some individuals become more irritable, anxious, or easily frustrated. Others seem unusually calm, detached, or indifferent to things that once mattered to them. This isn't just a personality change. It's often the result of the brain adjusting to the body's slippage. As cognitive function slips, emotions become harder to express and the person may stop reacting to situations in the way they used to. For family members, this phase can be especially difficult. Watching a loved one lose touch with reality or jump around emotionally can feel like losing them before they're actually gone, but it's important to remember that this isn't something they can control. Instead of trying to bring them back into conversations, the best thing you can do is meet them where they are. Speak kindly, offer comfort, and understand that even if they don't always respond, they can still feel your presence. If a loved one is becoming more forgetful, more confused, or less engaged, don't ignore it. These are often early signs that the body and mind are preparing for the final transition. This is a time to be patient, appreciate quiet moments, and focus on creating an environment that feels safe, familiar, and peaceful. Because even when words run dry, love and comfort can still be felt. Let's move on. Number 4. Frequent infections and slow healing. As the body begins to break down, one of the clearest physical signs is a sluggish immune system. You may notice that someone who rarely got sick before now seems to come down with every cold, every flu, every minor infection that comes along. What were once minor illnesses now take much longer to recover from, and simple illnesses, like a small cut or infection, heal at a noticeably slower pace. These changes are not random. They are signs that the body is no longer able to defend itself or recover the way it once did. One of the biggest concerns is repeated infections. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system breaks down. Many families assume that these are just one-off illnesses, but when they start to happen frequently or take a long time to break down, it is often a sign that the body is losing its ability to fight back. Even antibiotics that once worked quickly may seem less effective. A person may need stronger medications, longer recovery periods, or multiple rounds of treatment for infections that once would have been minor. This happens because as circulation dries out and organ function slows down, the body simply doesn't respond to treatment as well. Another problem is chronic disease. If you notice that small wounds, sores, or infections aren't healing properly or keep opening up, it could mean that circulation is compromised. Poor blood flow means that oxygen and nutrients aren't reaching the skin and temples effectively, making healing much slower than normal. Pressure surges, especially for those who are less mobile, become a serious risk and can lead to dangerous infections if not carefully managed. What's even more worrying is that infections in the last year of life often don't look the way we expect. Instead of a high fever, an older person may simply seem more tired than usual, more confused, or less interested in eating. In fact, for older people, a slowing of mental alertness is often the first warning sign of an infection, even before other symptoms appear. That's why recognizing these changes early can make a difference in how much comfort and support they receive in the last year of their lives. For families, watching a loved one go through repeated infections can be both frustrating and emotional. It's tempting to push for aggressive treatments, hoping that another round of antibiotics or another hospital stay will do the trick. But at a certain point, the focus often shifts from healing to comfort, making sure they stay hydrated, keeping their skin clean and moist, and minimizing stress on their body can do more for their well-being than another round of medications that only prolongs their suffering. If you are still watching this video and finding this information valuable, please comment number 4 below to let me know you are here. And if you haven't subscribed yet, I recommend you do so and ring the bell so you don't miss any videos. Your support helps us continue to create great content to inform and inspire you. Now, let's move on. Number 5. More major changes in breathing or circulation. One of the most telling signs that the body is preparing for its final phase is a noticeable change in breathing and circulation patterns. You may notice that your loved one is breathing more slowly or shallowly than before. Sometimes they may pause between breaths or their breathing may become irregular, speeding up and then speeding up unexpectedly. Some people experience a gentle, rhythmic breathing pattern called Cheyne-Stokes breathing, in which breathing alternates between deep, rapid breaths and long pauses. These changes may begin suddenly, but over time they become more pronounced and more frequent. Another common sign is poor circulation. You may notice that your hands, feet, or even your nose and ears start to feel cold to the touch. Your skin may appear shiny, blue, or patterned, especially around your fingers and toes. This happens because your body prioritizes blood flow to your vital organs, reducing circulation to the extremes. It's a clear indication that the heart isn't pumping as hard as it used to. Some people also experience more pauses in breathing, even with minimal movement. Just sitting, talking, or changing positions can cause them to feel cold or short of breath. You may notice them breathing through their mouth more often, or they may suddenly need to stop and catch their breath while talking. If they were once able to walk across the room easily but now struggle to do so, their blood function may be declining. In some cases, the fluid buildup in the lungs can make breathing more difficult. This can cause a persistent chesty, rattling sound, or even a tight feeling in the chest. Many people assume it's just congestion from a cold, but in older individuals nearing the end of life, it's often a sign that the lungs are getting cold. This can make sitting uncomfortable, and they may prefer to sleep in the closet or in a recliner to help with breathing. For family members, seeing these changes can be frightening. It's natural to want to help, to encourage them to take deeper breaths, or to worry that something urgent is happening. But in many cases, this is simply the body's natural way of slowing down. There's not always a way to reverse these changes, but there are ways to make them more comfortable. Keeping the room warm by using a space heater or offering small glasses of water can help ease discomfort. In some cases, medications or oxygen therapy can provide relief, but the focus shifts to comfort rather than trying to solve the problem. If you notice these signs, changes in breathing, cold hands and feet, or a blue tint to the skin, pay attention. These are often indicators that the body is conserving energy and that circulation is speeding up. It's a time to be present, to offer comfort, and to create a peaceful environment where they feel safe and at peace. In these final months or weeks, the most important thing you can give them is not medical intervention, it's comfort, dignity, and the knowledge that they are not alone. Final thoughts as we come to the end of this video. Take a moment to reflect on what we've discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation. These 5 signs usually appear in the year leading up to a person's senior years. They may not all happen at once, and they may not always be obvious at first, but when you start to notice them, it's a sign that the body is preparing for its final transition. For many families, these changes can be difficult to accept. It's natural to want to fight them, to encourage a loved one to eat more, move more, or push through exhaustion. But sometimes the best thing we can do is listen to what our bodies are telling us. Instead of focusing on trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about being afraid of dying, it's about preparing for it. When you recognize these changes early, you can provide better care, make important decisions ahead of time, and ensure that their final months are filled with love and dignity. This is a time to cherish moments, share stories, and let them know that they are valued and not alone. If you're noticing these signs in someone close to you, take a deep breath and remember that you're not alone on this journey. Many families have walked this path before, and while it's never easy, knowing what to expect can help you find strength, patience, and peace. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so don't hesitate to share them. Reading your comments gives us motivation and encouragement. If you enjoyed this video and found it useful, please like, subscribe, and share. Your support helps us continue to create great content to inform and inspire you. Thanks for watching, and we hope to see you in the next video.